my name's Allison. I will be your student nurse today. Can I get your name and birthday? All right, so I'm looking at his wristband and that checks what I have in my records. So first today, sir, I will be just checking your site, maintaining that it's patent, and I will be giving you a flush. So, we did our hand hygiene. Now we're going to put some gloves on. Okay. So we're looking at the insertion site. We're looking for any swelling, redness, pallor, pain. We're asking the patient if they have any pain. Are you having any pain or discomfort at the site? No? Okay, great. So that all looks good there. And then the other part to maintaining your saline lock is you are going to do a flush. So we begin with our alcohol. And we are going to clean off that port using friction, holding tight, or firmly I should say, securely, with the other hand for 15 seconds. Okay, that's been 15, and then we want to allow that to dry for 10. And while we're allowing that to dry, we will get our flush. We'll be doing 2 milliliters. I'm going to take that cap off. I will be getting any air that may have been in the flush out. Okay, we've done that. And it's been 10 seconds, so now I will attach my flush to the port. And before flushing, I'm going to aspirate for a blood return. We are seeing a blood return, so that means that it's patent. If we would not see a blood return, I would gently push to see if the fluids do go in. If it doesn't go in, that could be indicative of two things. Either there's a blood clot, or the IV, the cannula is actually resting on a blood vessel, and then we would gently push through, and that cannula would come off the vessel. So we've got that blood return, so I'm going to go ahead and flush. Having any discomfort with that flush? No? And I did assess any allergies earlier too. Does not have any. Okay, so we've done that. We can discard that. Then we would alcohol off that port. Once again, 15 seconds using friction. All right, and that is how you would maintain your patent IV lock. So now I will transition into giving the ceftriaxone via a saline lock. So I did assess allergies earlier, and I've got my ceftriaxone. I will be pushing 2 grams in 20 milliliters of fluid. I've double checked the patient's name, birthday. I've got that in the MAR, I've got that on my medication, the date it'll be given, the time, expiration date, so we are all good there. Okay, and that has obviously, we've done that flush already and cleaned it with the alcohol. It's been dried for 20 seconds. And since we've got 20 milliliters, we are going to give this at a rate of 2.5 milliliters every 15 seconds. This medication can be given over a time span of 1 to 4 minutes. I have chosen 2 minutes. So, we've got all the air out, so we're good to go there. Okay. Make sure I move this spot so I can hear or see you. Okay. Go. Okay. And while we're giving this, we want to ask the patient how they're feeling. And I did not say this earlier, but the ceftriaxone, sir, will help treat your infection that you have going on. This is an antibiotic, so it'll help kill that. And the reason why we want to give this at a slower rate, the faster you give a medication, the more discomfort the patient will most likely feel, the more adverse reactions the patient will have. So you lessen those chances by giving it at a slower rate. Okay, how you feeling, sir? Good? Okay, wonderful. About 30 seconds left. Okay. Again, we can dispose of that. I'm going to grab the alcohol wipe. Alcohol off that port for another 15 seconds. Using friction. Okay. I'm going to allow that to dry for 10. And then we'll grab our second flush, which we will administer at the same rate at which we gave our medicine. And the reason for that, there is some medicine still left in this J-loop. And if we were to give, just go 2 milliliters, they would have a bolus of that ceftriaxone, that antibiotic. So we want to give it at the same rate, and we've got 2 milliliters. So we'll give it at about 2.5, or we will give it at 2.5 for 15. Okay, so that's been 10. Again, getting the air that may be in the flush. Okay, that's dried. I'm going to attach. Make sure you can see my tube. Okay, and here we go. Okay, just like that. One last alcohol here for 15. Using friction. Okay, it's been 15. I'm going to remove my gloves, perform my hand hygiene, document what I just did, any findings that I have discovered, and I will return to the patient in about 15 minutes to check on him.